Hi, my name is Deandra Figueroa, and today I will be presenting on children diagnosed with autism spectrum disorder as well as a hearing loss. Autism spectrum disorder is a neurodevelopmental disorder that greatly impacts a child's social and communication skills, as well as these childs demonstrate behaviors of fixation and repetitional patterns. As we know, children with ASD have increased in the last few years. According to the U.S. Center of Disease Control and Prevention, Autism and Developmental Disabilities Monitoring has recorded the prevalence among those diagnosed with autism is 1 in every 59 children in the most recent study done in 2014 to 2018. Of ASD in deaf and hard of hearing children. 1 in every 76 deaf children was found to be receiving services for both hearing loss and autism. This is about twice the prevalence of hearing children. Hearing loss occurs more often in children who are autism than children without autism. At least 4% of children who are deaf and hard of hearing have an autism spectrum disorder, which can further complicate communication development. Even with the case studies, professionals still have difficulties with diagnosing the process and appropriate interventions to address communication challenges in these children, especially these children that have both of these diagnoses. As you can see here on this graph, it shows the prevalence of those diagnosed with autism as well as the connection with hearing loss. This rate has greatly increased in the last couple of years, and however, the diagnosis and the interventions that are used are still not at the level and the par, which are now impacting, possible long-term improvements or outcomes in these groups of children. So now let's talk about screening. There is no ASD screening tool that has been validated or is reliable for children who are deaf or have hard of hearing. And the most one that most people use is the MCHAT and the SCQ. However, both of these have been found to either over or under identify children who are deaf and hearing and as somebody who has autism. However, it's still important to refer children for full-on comprehensive assessments, especially if you see some red flags. So some red flags that you would see in children with hearing loss that could possibly have autism is atypical preverbal communication, atypical language features, and social difficulties, as well as repetitive behaviors and restricted interests. I want to focus more on the social aspect than the communication aspect because, as we know, both of these populations tend to show language delay, especially if visual language or auditory language was not presented at an early age. So this sometimes will cause a hard of hearing child or a deaf child to be below their hearing peers because of lack of exposure. Now, when we talk about social, that's like automatically autism. We know they're going to have those difficulties with interacting, with that joint attention, with wanting to start conversation. However, a typically developing child with just hearing loss is not going to have these social defects. They're going to be able to imitate motor. They want joint attention. They want to socialize. They have great eye contact. But a child who's hard of hearing and demonstrates signs of reduced social smiling, limited or inconsistent eye contact, limited given shared behaviors, difficulties with joint attention, that's a sign to show like this child is not just hard of hearing or deaf. He may also have a diagnosis of autism or some form of social difficulties. So this brings me to diagnosis. So currently, a hearing child that's diagnosed with autism will get 1 year ahead. They will be diagnosed by the age of 3, but a deaf child with autism will be diagnosed at the age of 4. That's a whole year of therapy that this child has now missed. Currently, the golden standard is the ADOS2. However, it's not validated and it's not really modified for children with deaf and hearing, the speech language pathologist needs to modify it so it kind of skews the results a bit. So, we really need to be very professional and find and look at the key marks of both of them in order to really diagnose, because that's our core thing. It's looking at these behaviors and observing them. So, intervention for dual diagnosis. Currently, there is not you know, the perfect type of intervention. Currently, what a lot of speech language pathologists will do is that they will do interventions that are for an autistic hearing child and then just kind of modify them for a child that's deaf or hard of hearing. The ABA approach is considered the standard of care. It must be intensive, target intensive, 25 to 40 hours, with weeks can improve language and social cognitive behaviors. So we, as speech language pathologists and young speech language pathologists, I think we really need to put in the aspects of what are some good intervention types of methods for this population of children diagnosed with not just a hearing loss, but as well as a autism spectrum disorder diagnosis. That is my presentation, and I hope you enjoyed it. Thank you.